Hey, we're here with Dr. John today, and we're going to be talking about smoking and tobacco and ways that we can quit. Dr. John has definitely had a lot of experience in this, and so we're going to ask him some questions, not with smoking or tobacco or anything, but just in dealing with it. We're going to ask him some questions today and get some answers for us. Hey, how's it going?
Good, and I do not smoke and never have.
Well, that's good to know. Hey, question for you. Tell me a little bit about the habit, what it does to your body, and what you've seen in our applications here at St. Christopher Fund.
Well, let's start off by saying that smoking cigarettes is the easiest way to die fast. It causes premature aging. You can take a smoker and a non-smoker, both the same age at 40, and the 40-year-old smoker will look 60. We find changes in their physical exam, their skin tumor, their lungs especially, their throats. They have a cough. Most of them have a chronic bronchitis. And eventually they get sick and die from it. And so it's preventable death. It's the leading cause of preventable death in the United States, but unfortunately it's a self-induced problem. And people that smoke tend to have a hard time quitting. And it's more predominant in males than it is females, but it does the same thing. I think that females mostly try to smoke to lose weight, and what they find is the hand-to-mouth thing, which we'll talk about in a minute, just overwhelms them. So if they're not smoking, they're eating. And people think that, well, you know, if I eat, then I won't smoke, but if you eat, you get morbidly obese. And you'd be surprised how many of our smokers are morbidly obese. So it's kind of a catch-22, and then if you add on the other problems with smokers, hypertension, heart disease, the obesity, sleep apnea gets in there. And if you took all the smokers that have sleep apnea and took the ones that die out that have sleep apnea, which would be 100%, and you would find out that the ones that smoked were 99% of the patients with sleep apnea that continue to smoke after they get sleep apnea. Mm-hmm. Now, people say, well, I can't quit. And if you think that way, you can't. If you think, well, I'm going to quit, like we've had some of the people with the new program that you headed up, said, I'm quitting. And we've responded to them and said, okay, good, it's going to be hard. And sure enough, it is. And they get down to being off the cigarettes. And there's something that is almost miraculous, that when they get off, and they've been off a week, how much better they feel, how much more alert they are, how much more energy they've got. But then at that week, the lungs start to kick back on, and if you're one of these people with a wet cough, which most smokers are eventually, they bring up phlegm every day. Well, that phlegm starts coming up because all that tar in the lungs starts to come out, and they cough it up. But if they can make it through that, they do okay. The hard part is the hand to mouth. They're used to doing something. It's something that keeps them busy. And when they're driving, because it's obviously when you're driving, what are you going to do to keep you busy? I mean, you can whistle. And there are some things that people do that have worked. One is toothpicks. Two is gum, sugar-free gum, and they chew that constantly. And then one of the other things that helps people is sunflower seeds. They'll get a big old thing of sunflower seeds, but pretty soon the seat next to them is full of sunflower seeds. So the hand-to-mouth part is probably the most difficult. And then food takes over, and then food leads to weight gain. And they say, well, I had to start smoking again, I was gaining weight. Well, no, you started smoking again because you thought that would help you lose weight, but it doesn't, because now you're used to the food, and you're going to continue the food. So we find that in the charts we just looked at today, 80% were heavy smokers, and of these we saw today, most of those are going to die probably within the next year at the most. Now this is 80% of the charts I looked at today, and I would
One day.
Yes, and I've still got a couple of more to go through, but we're still at the 80% mark.
Mm-hmm.
So if you plan not to live long, continue to smoke. If you plan to look like an old shriveled up prune by the time you're 60, when you're still 40 or 50, continue to smoke. If you want to get healthy, quit. And that's the only thing I can tell you. And if you quit, you've got to exercise. If you quit, you've got to stay active. If you quit, it's got to be a motivating factor by you and you alone, and nobody else can do it for you. But if you look into some of the pictures of people that smoke, that the head and neck cancers that we see, it's just unbelievably disfiguring, and the illnesses that they have. People that are so morbidly obese they can't get in and out of their truck, but they're smoking 4 packs of cigarettes and spending $20,000 a year. So the cost of it alone, one trucker said that he saved $120,000 in 5 years when he quit smoking.
Unbelievable.
Yes.
So can you address the issue of nicotine as far as dipping and chewing goes? Because some people think that that's a healthy alternative and they will stop smoking and start dipping.
No. Dipping is harder to quit than smoking. Okay, we know that from just history of patients. I can't quit. And what it does is it tends to localize in the mouth and the upper neck, and they get head and neck cancers. So we see quite a bit of that in the St. Christopher Fund, and it's hard to quit because it's a more concentrated nicotine. They're usually dipping it in pouches and so forth and so on. So we've come up with some things like grinds, which is coffee grounds, and I actually did the science on it myself. I got a bunch of them, kept it here in my drawer, and at my age, when I get up anywhere from 4:30 to 5:30 in the morning. And about 10 o'clock, I kind of have a sinker. Well, I'd take one of these grinds, and it comes in a little pouch, and I'd put it in the cheek and gum, and it would wake me up. And then I tried all the different flavors to see which one I liked. And it took me about 2 months to figure out that, yes, it works. So if I put one of those in my cheek and gum, one, as I had something in my mouth, so I didn't have this feeling I need to get a piece of gum or anything else, and it actually helped my bad breath. I don't have bad breath. I don't think I do. I'll have to ask some of my female friends. But the thing about it is that it's an alternative. Now, is it something that I say everybody go out and get grinds so you won't start smoking? No. If you're going to start smoking, you're going to smart. It's very hard to quit. Whenever you see somebody smoke, you're going to want to smoke. It is probably if you take heroin and you take nicotine in lab animals, and you see which one will go across a lethal charge of electricity to get to that particular substance, either nicotine or heroin, the one going across and to get to the nicotine will go across a lethal charge to get to it. The other one won't.
So more addictive than heroin.
It's very difficult. And why it hasn't been, of course, the cost of it is ridiculous. 1 pack a day is a little under $5,000. 2 packs, it goes up, and then we've got truckers that are spending $20,000 a year, and they're buying the cheapest cigarettes made. So how they do that, I don't know. But it's death eating a cracker if you're a smoker.
So with the grinds that you mentioned, would that be beneficial to someone who smokes, not just someone who dips, correct?
Smoking and dipping, it helps because it gives them that feeling of alertness. Chewing gum does too, believe it or not. When I drive, like if I'm going to drive from here to Shreveport, Louisiana, I get up at 2 in the morning and drive till I get there, I will chew gum. Gum releases what we call endorphins, and endorphins keep you alert, and your face is doing something. sucking on a cigarette. The other thing too is you'll notice you don't get as many dental problems. All smokers have no teeth, and if they do, they're very sick teeth that eventually will have to be removed. Same way with dippers, they get the same way. The only thing worse than smoking and dipping on teeth is if you're an addict with methamphetamines. So they call it meth mouth. Now you can spot them a mile away. They have no teeth, and of course they get within 3 feet of you. They smell like ugh. You know, I can't describe how bad your breath is. And that's the other thing with the truckers is that we've not been able to get them to change their habits very easily. It's been very difficult. I've been doing this for 25, almost 30 years now. And I can count probably on both hands the truckers I've known that have quit smoking and stayed quit. I've actually had people lose weight better. I've had people take care of their hearts better, but quitting smoking is difficult, but it's a killer.
Well, I know that there are a lot of people out there that know who you are, and I guess we should have started the interview this way. But just for the record, let people know that are listening or watching right now, you know, how you got into helping truckers, because it wasn't your primary vocation at first.
No, I was an internist, and then I just happened to get into occupational health because of my master's degree in public health and occupational health and safety. But I noticed that truckers that came in weren't as healthy. And so I started going to truck stops and looking at truckers. And sure enough, I saw really sick truckers. And over the years, I would make sure whenever I went anywhere, I'd always go and sit at a truck stop. And so one day it dawned on me I didn't have to go to Haiti or Costa Rica or Guatemala to help sick people. I could go to a truck stop. And that's what I did. And I've been taking care of truckers ever since. Then we started the St. Christopher Fund. And that was difficult. It almost failed on several occasions, and thanks to OIDA and people like that and T.A. Petro, it's now thriving, but it's still not where it needs to be, and it needs more help from truckers. And of course now truckers are what keeps it going. We have a lot of big contributors, but still the truckers are the ones that keep it going. And the ones that have been helped, it's miraculous, and the ones we've helped have an easier death and maybe take care of their families a little bit as much as we can, because it's very expensive to do what the St. Christopher Fund does, and Donna and her staff do a great job.
So one thing that we haven't really talked about, and I don't hear it talked about much as far as smoking and dipping and things, explain what it does to someone's eyesight, because that's not mentioned very much.
It does. It tends to speed up things happening in the eye, because a dedicated smoker will not even hardly take a cigarette out of his mouth. That smoke just goes up into their eyes. And you keep a kind of a red eye to begin with, an irritated eye, a dry eye sometimes, and then sometimes it makes if you're genetically predisposed to cataracts, it speeds up that formation. And then at night they have problems with lights and things like this. We probably pick up 100 cataract cases a year. They're always in smokers, and they're always here in truckers.
So it speeds up cataracts, and isn't there something it does something to the macular degeneration as well, or?
Well, no, it doesn't cause macular degeneration. It doesn't help it because it's a vascular problem, and macular degeneration is a vascular problem. So anything that affects the vascularity of anything, including your heart. Now, when we do physicals on truckers, that's why I look in the back of their eye, because if I see real narrow arteries, I just tell them, look, you're going to have a heart attack, because that's called a window to the body. And if I can see it in your eyebrows that you have arteries that are just silver wire, what we call them, or copper wire, then you're going to have a heart attack.
So how much do you feel if someone were to stop smoking today? What would it take for their bodies to start going back to a normal state?
The number that keeps coming up is it takes about 10 years before you're back to normal. If you're going to get back to normal. Now, if you've already got a disease process like emphysema, it may never stop. It may get better, it may stay where it is, or it may keep progressing. The big thing that truckers get is what we call chronic bronchitis. They're just coughing up gobs of goop every morning, and it gets worse and worse, and then eventually they get a pneumonia or the flu, and then followed by pneumonia and die. So if you're a smoker, your upper respiratory tree is being damaged every time you light a cigarette. And there's an old saying, it only takes one a day to kill you, and that's the truth.
So we'll wrap this up by, if you would just give us one more time, tell us some of the things, some of the tricks, some of the tips that a person who is trying to stop smoking, stop dipping, stop chewing, what they can do to help that hand-to-mouth addiction.
The hand-to-mouth addiction is probably the hardest part. The mental addiction, there are medications that your doctor can work with you on, but he's got to be skilled at it. He's got to be able to see you. If he's not, they don't work. The nicotine gum doesn't work because it makes the teeth hurt, stuff like this. Some of the things that don't hurt you are, of course, just a toothpick, just something to chew on. The things that seem to be most satisfying are the sugar-free gum, which we talked about, and also the grinds, which we talked about, and also the foods that do not have a lot of calories, and that would be the sunflower seeds, stuff like that. And then if you do want to eat while you're driving, look at something like pecans and walnuts, but don't eat in gobs of them. You still got to look at the calories. But that hand-to-mouth thing is the hardest thing. There's something that's non-caloric, like a toothpick has no calories. So you can go into things like that and try it. Now, is it something you can say is going to work every time? No. Because the power of nicotine is unbelievably powerful, and it'll get you. And if you don't overpower it with your brain and deny yourself, that's the thing. You just got to say, no, I'm not going to do it. And then find something else that you can do in the meantime. I have never smoked, and I've never been addicted to it, so I don't know what it's like. But the reason I didn't, because I saw what it did to my parents. And they both died from it.
Really? Well, I appreciate you coming and talking with me a few minutes today. I know you probably are very busy and have a lot going on. We have a couple of comments here. Someone said it's not as hard as we make it. We just have to want to quit, from Rick. And then Michael Freiberger, which I think you know who he is, flag waver. He says, happy birthday, Dr. John.
Oh, well, good. Thank you, Michael. Flag waver.
Well, thanks very much for talking with me. And if people have questions, you can still send in your comments to us, and we can get those questions to Dr. John. Thanks. You want to say anything else?
No, I'm not sure I have that quite right.